announcement for pets, as my husband just told me. Do not let them out for more than a few minutes because the wind chill factor is very dangerous, and don't take them for walks. That's
Thank you.
my little dog would be whisked away. It's so windy. Anyway, so
Great, thank you for that. Yeah, I saw your little dog back there. Jennifer, am I showing the right screen?
You're on slide 2.
Good,
And yes.
good, good. All right. All right, this is good because I have four presentations. This is my first one, so I'm getting all the kinks out early on a Tuesday morning of which screen I'm sharing and all of those things. So thanks for having Jennifer and I join today. We're really glad that Kelly and you all asked for us to join and talk about the Center on Aging and Community Living, the synergies with the university, intersections with other initiatives. So we're going to do our best to, kind of tell you what we do and how that intersects with a lot of the statewide partners and things going on. We're happy to entertain questions as we go along, so don't hesitate to. Probably best for me to just unmute yourself and start, screaming, because I have a hard time seeing raised hands while I'm presenting. So, all right, see, all right, good. So the Center on Aging and Community Living, as Jennifer mentioned in her introduction, so it is a collaboration between both the Institute on Disability, and that's the home base for Jennifer, and the Institute for Health Policy and Practice, and that's the home base for me. And back in 2011, the two institutes, we had been both working on a lot of long-term care system grants and partnerships with both the state and the community. We were starting to buy each other's time and FTE and sharing staff. And we really knew, 10 years ago plus, the aging demographics of New Hampshire and Northern New England, and really wanted to raise up and put more of an awareness to that, and also help coordinate our efforts within the university, specifically under the umbrella of the College of Health and Human Services. So like any large organization and bureaucracy, we have, you're going to walk away today, maybe hopefully, being more familiar with a lot of the work that the center does and the initiatives that are going on. But I always tell people it takes a few years to really get a grasp of, who's where at the university, who's where at the state, and really the main thing is knowing who to call and ask a question to. And so Jennifer and I are always available for that. One of our core values is person-centeredness, and this really comes from, what it means to us is creating systems and providing training and support to providers who work within these systems, that everyone has access to person-centered options that allow them to live and age in the communities of their choice. And CACL defines providers very broadly. We include medical, community, for-profit, nonprofit. So I wanted to put that out there, and it includes across aging and disability systems. We also define community really broadly, and I think those are words, both provider and community, when we've been doing projects that are trying to bridge together the medical and the community social services. If you don't say up front what you're talking about when you say provider or when you say community, you're going to get off on the wrong foot, because we don't have the same definitions. So always a great place to start. You can see on this slide, it's our mission, which we, kind of to get to our vision. Just the other kind of points I want to say about the center is we are 100% grant funded, and our funding comes from federal and state government and private foundations. We have about 12 staff between the Institute on Disability and the Institute for Health Policy and Practice, and providing the technical assistance, evaluation, training, facilitation, convening. And Jennifer will talk about it a little bit more. A lot of our work is as a neutral convener, bringing together stakeholders across systems to create solutions that are in the best, always with the person, the client, the person, the people who are in aging and older people and adults with disabilities. Those are the folks that all of our work is focused on. And I think with that, I'm going to hand it over to Jennifer.
Thanks, Laura. So just a little more of an overview of CACL. CACL strives to be a leader in the aging field in New Hampshire and beyond through the following core activities that you see on the screen here. Through its project work, CACL links the university to the community and brings current long-term care and aging activities and understanding of these activities into the classroom. CACL staff provide service to the community through involvement on a variety of state and community boards and commissions. And through these service activities, staff are able to influence public policy, provide leadership around aging issues, and promote a positive image of aging. We also provide, and we're going to talk about some of our core projects in a minute, but we provide applied research, evaluation, and technical assistance with the goal of improving knowledge and influencing policies and practices across the state. And then finally, another of our core activities, as Laura mentioned, is that in being a neutral convener to bring together leaders in the aging network. Next slide, please. So here is a listing of some of most of our current projects. We're going to touch on each of these briefly, some a little bit more in depth than others. So I just want to point your attention to this last one because we aren't going to touch on this in future slides. Over the last 10 years, CACL has hosted a number of statewide conferences on aging in playing that role of convener. Our last one was in November of 2019, and we were able to lift up a full day conference on aging with a really great attendance of over, I think we had over about 165 people. And so we look forward to planning another one in future years to come. Next slide, please. So I'm guessing, thank you for doing that transition and knowing it was there, Laura. Um, I am guessing that most of you have some familiarity with AHA. I know that I have recently touched base with many of you, and thank you very much for your interest regarding the New Hampshire Alliance for Healthy Aging. Just as a real quick reboot, for those of you who might not be as familiar, so the Alliance for Healthy Aging is a statewide coalition of stakeholders that's focused on the health and well-being of older people in New Hampshire. And as I talk about the Alliance for Healthy Aging, I always want to mention that CACL's role in this project is that of backbone support. So we are there to lift up and provide the infrastructure to the Alliance for Healthy Aging. And we have a team within the center that includes 4 individuals, 4 staff at the Center on Aging and Community Living. So when I'm talking about it, I never want people to think that since I'm the face, that I am the only one from CACL working on the Alliance for Healthy Aging. We actually have a really robust team. So with that, I would like to go to the next slide, which is a short video that we use as a communication piece. It's a fun way to do an overview of the Alliance for Healthy Aging and its activities. And if technology works for us today, we're gonna play it for you, give you a break from our voices.
I think I need to stop sharing and share with audio first. So I'm going to do that, and hopefully share again. Okay. Step 2.
I don't hear the sound.
Longer, healthier lives. New Hampshire has a powerful opportunity to rethink the future of our communities. Like most states, current employment practices, public transportation systems, and housing policies make it difficult for older people to stay involved and contribute as they age. That's where the New Hampshire Alliance for Healthy Aging comes in. Established in 2016, the New Hampshire Alliance for Healthy Aging is a group of engaged stakeholders focused on the health and well-being of older people, with more than 300 participants and over 185 organizations and groups represented. The Alliance works to promote a shared vision to create communities in New Hampshire that advance culture, policies, and services which support older people and their families. As we raise a collective voice in support of healthy aging in New Hampshire, the Alliance is currently focused on 5 strategic priority areas: improving the workforce availability for quality healthcare and social services, enhancing support for family caregivers, increasing transportation options, advancing zoning changes to promote affordable and accessible housing options, and developing an advocacy infrastructure. There are many things we can do to harness the energy and experience of older people and enhance their ability to contribute to our communities. For example, engaging in advocacy allows individuals to raise their voices, helps inform and educate policymakers, and build stronger communities. Visit our website at nhaha.info to learn how you can get involved today. And together, we can make New Hampshire a great place to grow up and grow older for all of us. As more of us
Thank you, Laura.
live longer, healthier lives.
Couldn't get it started, and now it doesn't want to stop. So thank you, and you can go back to the slide deck when you get a chance. So that's the broad overview of the Alliance for Healthy Aging, and we were very intentional about the language we used in creating that. So as the Alliance for Healthy Aging grew, we became aware that there's so many pieces and parts to the Alliance for Healthy Aging that it was hard for folks to sort of wrap their minds around what the Alliance is at its core and what we're working on. So that video was our way of creating simple messaging that hopefully is memorable and easier to understand. And I know that I presented here a couple of months ago on reframing aging. So hopefully you will have seen and maybe even picked up on some of the reframing aging recommendations that we folded in there. And in particular, really emphasizing that older people have assets and bring so are part of the solution and bring skills to the table as well. So broadening the perspective on how older people are viewed. So this slide here represents the vision of the Alliance for Healthy Aging. And so you can see that there are 6 domains that are components of the vision, and you see the vision up in the upper right-hand corner. These 6 domains take into consideration not just the whole person, but the whole social, economic, and physical context of older adults. So it's not unlike the World Health Organization and AARP age-friendly model, but we've customized and combined domains to be specific and meet the needs of New Hampshire. And it was out of these domains, with the use of an environmental scan, that the Alliance for Healthy Aging adopted its current 5 strategic priority areas. So I should note that the Alliance for Healthy Aging is currently going through a strategic planning process. So we are taking a look at the vision and the mission and the values of the Alliance for Healthy Aging. Not that they will significantly change, but really just as the Alliance grew very quickly and evolved very rapidly, looking at how we message and making sure that our vision and mission and values still hold today. Next slide, please. So just a few quick facts on the Alliance for Healthy Aging. And you heard in the video, there's over 100 participants. It's actually over 325 participants engaged in the Alliance today, representing over 185 organizations and or groups. The Alliance for Healthy Aging partners with state entities to advance its work. And I really want to note here that it was a driving force behind the development of the Commission on Aging, which just completed its first year recently. And over that first year, the Alliance for Healthy Aging played a significant role in providing trainings and education to commission members to help foster a broader understanding of the field of aging. And we continue to align the work of the Alliance for Healthy Aging with the evolving work of the Commission on Aging. And the Alliance for Healthy Aging also participated in the development of the current state plan on aging and continues to also align its activities with this plan. And in fact, at our next quarterly meeting, and before we're done here, I'll put a registration link in the chat if folks are interested. The next quarterly meeting is on March 10th from 9:30 to 11:30. We'll be hearing an update from Wendy Altman on the state plan on aging. So we continue to play a role in in helping the state create transparency around the activities of the state plan on aging. Next slide, please.
Sorry, Jennifer, before you move off the Alliance for Healthy Aging, Pathways recently became its own nonprofit, a 501c, I think a 501c3, right, Joy? Oh, no. They're just wondering.
501c4, I'm sorry.
501c4, okay. Joy was asking, is the Alliance for Healthy Aging a nonprofit? So I'm wondering if you could touch a little bit on kind of that background for the Alliance and the intersection with both us and New Futures, maybe.
Sure, I can't, for some reason, I don't see a chat, so I'm assuming that's where that came from. So the Alliance for Healthy Aging has not officially filed for nonprofit status. It is still, as it is developing more of a looser affiliation of individuals and organizations. And there's not a current plan to file as a nonprofit. And I'm not sure what the question was about New Futures.
I was just wondering, so the funding to support, it wasn't a question that I was adding that as potentially part of an explanation of how the work of the Alliance for Healthy Aging. So for instance, Jennifer mentioned we're the backbone support. So funding for us comes from other foundations but there's also other organizations involved.
Yeah. So the Alliance for Healthy Aging is funded by two foundations, the Endowment for Health and the Tufts Health Plan Foundation. And you heard about in the video the 5 priority areas. And one of them is really, and possibly the most visible of the priority areas publicly, is that of building up that advocacy infrastructure. And so that is the only priority area that has distinct funding unto itself. So it also is funded New Hampshire Legal Assistance and New Futures as the lead entities for the Alliance for Healthy Aging's advocacy work are funded by the Endowment for Health and Tufts Health Plan separately.
So I'd like to say maybe one reason why you haven't applied is A, because you don't need funding, but 2, to be a 501c3 organization, your advocacy has to be limited. So that's why we're a 501c4 rather than a 501c3. So.
Thank you. Yes. And there's actually a multitude of reasons why we haven't applied, and certainly funding plays into it. And as we're learning through our strategic planning process, we've done some stakeholder engagement focus groups. And so what we're hearing from stakeholders is this sense that the Alliance for Healthy Aging, and we've heard this word used over and over again, or a collection of words, has a secret sauce. So we're not going to touch our secret sauce at this point in time. We're not changing anything that's
Gotcha.
going to mess
Yeah.
with that.
Yeah. Gotcha. Okay, good. I'm glad to know. Just good information. Thank you.
Yeah.
Yeah, and I think, you know, because we're a university and CACL takes in some of the funds, we're limited in what we would be able to do. And so
Right.
there's other partners that are better situated. And I
Right.
think, and Jennifer, you know, and personally, I think one of the many pieces is the Alliance is a collective impact. It is owned by everybody. And
Right.
so having that neutral convener and not setting up one organization as, you know, and
Right.
one, you know, everybody continues to feel more ownership and a stake, which is really what we want to continue to create.
Yes. Yes.
Yeah, and we are very intentional in how we play out the role of backbone support, in that we are not the face, the front. We are really meant to be behind the scenes to lift up the collective. And certainly, as Laura says, shifting to a nonprofit status would really change
Right.
that dynamic.
Gotcha. Okay, good. Thank you. Thank you so much.
Yeah. And so I want to conclude the work of the Alliance for Healthy Aging with just touching again on reframing aging. And I did, as I mentioned, I did present to this group a few months ago. And so just as sort of a overview refresher, the Alliance for Healthy Aging is really taking on the role of being a hub for the New Hampshire reframing aging activity in the reframing aging activity in New Hampshire. Um, and as a reminder, the Reframing Aging is a national initiative to change how we talk about aging and address the myths that are really prevalent in society and the ageism that is prevalent in society, by changing how we talk about aging, with the understanding that as we change how we collectively talk about aging, we can change how the public and how we collectively think about aging, which will help us better influence policy and practice for aging services. So in New Hampshire, we have trained 18 peer facilitators to provide educational opportunities regarding reframing aging. So similar to what I did, they can be customized for all different lengths and really focusing on different aspects of the communication recommendations. So if anyone here is interested in having additional presentations, just feel free to reach out to myself, and I can connect you to one of those trained peer facilitators who would be more than happy to do additional educational opportunities. And with that, Laura, I'm going to leave some time for you to cover some of our other projects at CACL.
And by Jennifer, that offer, and just so I'm clear, that's for your own personal organizations, just not Pathways. So if you'd like reframing aging expertise to come to your organization, just reach out to Jennifer.
And I can testify to the fact that it is a really interesting, I got to participate in one and it was really interesting. Thank you, Jennifer.
Great.
Thank you.
Thanks, Jackie. All right, so a little bit more, you know, Jennifer talked about different areas that CACL works in, and one is university engagement. Really happy to hear that you are all pleased with the new brochures for Pathways Through Aging. Our current University of New Hampshire MSW intern helped with that, along with one of our Bridget, I gotta say, Bridget Drake, who kind of brought it home, brought the vision home, which was awesome. So we do MSW students. We try to do it every other year. It's a lift, but we love engaging students in the work of working with older adults, and we really feel that it's important. We also have undergrad interns that do one-off projects for us. So a couple of years ago, I think with the Healthy Aging Data Reports, we had an undergrad intern pull all all the towns that Pathways Through Aging represents, and kind of give you a database so that you could say, hey, here's what we look like. So we love that kind of work. And if our interns have time and you have another one-off project, you certainly ask. Can't guarantee, but certainly ask. Love to support the community work. The Alliance for Healthy Aging, and connecting with Jennifer, we actually have a BSW intern from Plymouth State. So that's pretty exciting to bring the work of the center to across the university system and across many of our projects. We do guest lectures within the college. We do our own applied research and program evaluation and survey work. And community connection is one where really thinking about both our faculty and staff researchers. What are their interests? What do we, because we are so community focused and working with the state and the communities organizations, what do they need? And how do we help match the research interests and expertise with what the community needs to help move programs and policy forward? I do want to mention two things we're really happy about. I'm actually going to go to SADOR first. The SADOR series, which is at the bottom of the screen here, is a lecture series run out of the Center for Humanities at the university. And CACL's proposal for the 2021-2022 academic year was accepted. And the name of our proposal is, sorry, Deb, do you have a question?
I just didn't hear what you said.
Oh, am I going in and out?
I can't see the bottom of the slide.
Oh, I'm sorry.
I don't know if Deb, that might just be your computer because it's apparent on mine.
Oh, okay.
Yeah, so
Okay.
it's the SADOR lecture series run out of the Center for Humanities. Our topic this year is Aging in America, Justice for All. We are still planning it, but as we plan it, we are going to, of course, connect with Pathways Through Aging. So this is a series that will be open to our students, our faculty, our staff, and our community. And we really think that connection is vital as we talk about. That's the groundwork of the Center on Aging and Community Living. We want our students to hear from older people, from organizations, and we also want that intergenerational conversation to happen during this series. So I could talk about it forever, but as we launch into getting set up and getting some flyers, we'll share it with Pathways and share it. You guys can share it broadly too with your community. There's 5 pieces. The first will be Aging in America. We're all in this together. So it'll kind of be an overview of what is aging like today and lead into our other sessions. And they're a little diverse. Which is awesome. We have engineering for humanity, design, accessibility, and intergenerational partnerships. We have COVID-19 commemoration as protest, age, race, and class. LGBTQ+, the social injustice of being forced back in the closet. Aging in place, Black perspectives. And Woody, you'll be happy to hear, caregiving, honor and burden, contributions and impact. So we haven't set up our which session is happening when. That's our next step, and get all that information out for folks soon. But very excited about how, as Jennifer talked about with reframing aging, that'll be a theme throughout, how important it is to have the conversations and with across generations and across stakeholders. So pretty excited about that.
Laura, it's Anne. Is this going to be virtual?
Great question, Anne. we have about another month, I think, before we absolutely have to make that decision. I think Jennifer and I and what's neat, I'll say this too, while it's fresh in my head, this is a combination with one of our, with our partner in rec management and policy and our faculty fellow, Allison Wilder, who's just awesome. Okay. And somebody out of the Community Equity and Diversity Office at the university, and Casey from anthropology. So you can see some of that humanities and anthropology. So bringing us and all of these voices and experiences together and bringing, we're not going to be talking, we're bringing in experts in to have these conversations. So with that, we are very much leaning towards, we're going to, a virtual for the fall, at least. you know, the world's uncertain, but we have about another month before I think we really need to make that go, no go decision.
Great. What a lineup. That sounds amazing.
Yeah. But before we get to the fall, we have something pretty amazing happening in the spring, right? And that is our Age of Champions event. And last year in 2019, we had worked with you all, Pathways Through Aging, when we were gonna, you know, we were gonna be in person in the field house at UNH and have this Pathways Through Aging lineup of vendors and just put the word out both about Pathways as an organization and all of your individual work. And we all know one of the sad events is that had to be canceled. So we are doing it virtually this year. So we're still in our learning phase of what it means to put on such an event virtually, but it is going to be April 19th to the 23rd. And we're having events each of those days throughout the week. It is going to continue to be a collaboration with our students. So one of the main things and visions about this work is having students from each of the departments, including our partners in, nutrition services is actually in a different college. They participate. And also Casey and anthropology participates. So it's really become a university-wide event. And so have students talk about what they've learned and maybe do assessments or teaching and have those pieces, and then integrate with our community vendors and how we're going to put those vendors on this virtual platform. So this and then potentially some guest education speakers, and so it's still coming into being, I don't know, what do we say? I don't know, still mixing all the ingredients together to see what the cake is going to look like this year. But we do have a virtual platform. We're pretty excited about it. Our MSW intern, Jennifer, who you all have been working with, is on this. And then we have another grad student from Allison Weiler and Rec Management Policy, who are both our rock stars and helping putting this together. So if you haven't already, many of you might have gotten a vendor invite or information about becoming a vendor, but we would love to have a conversation about, what it might look like for Pathways Through Aging to participate this year as a kind of a collaborative and as your independent organizations. So you can have Kelly reach out and figure out, how to move forward on. Any questions before I leave that?
Nope. Thank you.
So, and just so vendors there is no cost to be a vendor. If you want to sponsor, we start at $250 and we can get all that too, but there's different levels, but our vendors, to be a vendor is no cost.
We're getting a lot of feedback, so could everybody mute themselves besides the presenters, please? Thank you.
Thank you. So, Jennifer mentioned the many projects that we work with, the Alliance for Healthy Aging being one. Another one that we have been working on really since the inception is, and the names evolve over time, like everything does, is the No Wrong Door System of Access for Long-Term Services and Supports. So over the past 10 plus years, both the Institute on Disability and the Institute for Health Policy and Practice under the center has been working on various, the administration on community living here, because that's the federal funder who really has this vision for the No Wrong Door System of Access. And then a couple of the main pieces that you might hear or have heard of include how New Hampshire operationalized this vision through our ServiceLink Aging and Disability Resource Centers and New Hampshire Care Path, Connections to Better Living. The No Wrong Door System of Access is really to say the federal vision that every community in New Hampshire and people who live in every community in New Hampshire should be able to go somewhere local and understand and get information on the long-term services and supports that are available, private pay, public funded, nonprofit funded, across the spectrum, and really help. The big vision is to help folks even before the crisis hits in, before they're those before they actually need it, to be more planful potentially. But even in those times of crisis, to know that there is someone local in your community who understands the full system and what's available, even volunteer options to help you make choices that are right for you. So that's really, the foundation. For a number of years, in I don't know, 2003, actually, the state designated service links as their central focal point for the No Wrong Door system. And so you can go there, and I think ServiceLink has presented here before, but what are your, what's available in the community? What they have: the Medicaid counseling, Medicare counseling, caregiver support program, just general information and referral assistance. So that's one piece of the work that we do, and they're all in all 10 counties, and I think there's about 12 or 13 actual sites. New Hampshire Care Path is another name that you might hear when you're kind of searching and saying, what is this system, or what's the broad umbrella of the system, the No Wrong Door system. And that was an effort that was funded under what was then called the Balancing Incentive Program. And it was really to say, we have service links as our focal point, as our main entry point into the long-term care system. But there's also other partners. We have our community mental health centers. We have our area agencies on developmental disability. We have our local Bureau of Elderly and Adult Services sites within the communities. How can we better assist individuals who are seeking and needing services and getting their questions answered? How can we better bring all of those entities together, provide information, and assist with choices, and really get people in the right place at the right time? Sometimes they knock on one door and it's really another area that might have more expertise. So making sure that there's some more warm handoffs. And Jennifer, did we just lose Jennifer? Shoot, she unmuted herself, and she is at, oh, there you are in the upper corner.
I'm still here. Yeah.
Sorry, the my squares moved, and I'm like, where'd Jennifer go? Did you want to add a little bit about CarePath?
Yeah, sure. I would say that the Center on Aging and Community Living really provided deep technical assistance in the development of the New Hampshire Care Path as a system, including the branding of New Hampshire Care Path itself. So it was an opportunity for us to engage almost our full core of staff in supporting the state around the development of New Hampshire Care Path.
Good. So yeah, so the No Wrong Door system of access for long-term services and supports. I know that's it can be confusing even for those of us in the system, right? But our work at the Center on Aging and Community Living is to provide technical assistance, provide training such that folks who are in these systems offer person-centered counseling and options. We have worked, some of the work, especially under the New Hampshire Care Path, was, what do the applications look like? How can they be more, how does the system change to be more person-centered and less provider-centric? Like, yeah, providers need information, but people need to give the information that they feel is valuable and in a way that makes sense to them to give that information. So it's ongoing work, but it is some of the landscape of New Hampshire, which I know Kelly wanted us to cover, and also how CACL intersects with that landscape. So we are almost through what we wanted to cover today, and we're ending here with the Senior Leadership Series. And again, I think we could maybe just unmute Woody and see if he just wants to share about his experience with the senior leadership. He was one of our early alumni, and it is a collaboration between the Center on Aging and Community Living, AARP New Hampshire, and the Dartmouth Centers for Health and Aging. It is 5 sessions that happen over the course of usually about April through November. And you can see the areas that we cover during that time. And as Jennifer said, a lot of things happened at that same time when the Alliance for Healthy Aging kind of was coming to fruition. It was like, we really need an advocacy infrastructure Senior Leadership Series. We'd had a couple years, couple cohorts under us, but really needed to ramp up. The non-provider voice is really the mission of the senior leadership. We want people who are not in the system necessarily advocating for what's best for their organization or what their tunnel vision is. And I know we're all good. But I'm going to have my tunnel vision when I'm advocating for CACL. We want people to who are living and breathing both the experience of being an older adult and who are passionate about creating the systems and advocating for the systems that they want to grow old within, that are going to work for them into the future. And so we have over 120 in our network now, and Woody is one of our graduates.
Yeah, it was a extremely valuable experience because it gives an overview of what's going on in New Hampshire. And I think the advocacy, I know when we got we increased the respite funding based on budget testimony in Concord from 100,000, I think we went up to 300,000 and so forth. So it can have some very meaningful results. And I would encourage anybody in the healthcare area to try and get into a position where you could participate in this program to further your career and help make a contribution to the entire healthcare community in the state of New Hampshire. So extremely valuable.
Great. Thanks, Woody. We did have to again cancel last year, which was going to be for a session, and we do it every other year. And just given the three entities decided that we would not try to make up the year this year. So you will be hearing into the fall, into the winter, what the 2022 series, when those offerings will be. And again, we would encourage you, you guys are starting to build your, advocacy as a strong piece of what you want to do, both as a group, but think also not only who's active in Pathways, but people that you want to bring along within the community to testify, to develop, to have their voice around. Again, that non-provider voice is really important, and we'll get more information out into the fall and work with you all during that time. And Jennifer?
Laura, before we move on this, one of the things that we have created over the last year, I don't know if you want to talk about the alumni network and how we connect alumni with the Alliance for Healthy Aging advocacy work and other aspects of advocacy across the state.
Yes, thanks, Jennifer. The Senior Leadership Alumni Network is a for many years we said, as the three entities, CACL, AARP, and Dartmouth, after graduation, and Woody will remember this, there wasn't an alumni network those first few years. There was just, hey, thanks for participating in the series. Here are some ways you can engage, go out and do great work, and what we decided was, and what we heard from alumni in some follow-up surveys is, yeah, some of them were engaging, some of them didn't know, life changes and goes on, and maybe they weren't engaged right away, but life has changed and they want to re-engage. And so the Alumni Network is an effort to continue to, over time, make sure alumni know what those opportunities are to engage across all types of advocacy opportunities. So not just with these three organizations, but the Alzheimer's Association often is one, or any organization they're interested in. We try to raise up those opportunities, try to give them opportunities to just to talk and connect about the work that they're doing, which is very valuable. They love that. And if we can do a little educational piece, update on some of the what's new in Medicaid or Medicare and what's new in the world. And so so that's one of the main purposes of the Alumni Network, and to make sure that, AARP is they're just awesome. Doug McNutt for years has been leading some statewide work and has I think all of the people on one of his capital projects is our alumni of the Senior Leadership Series. So they do a lot of work on the AARP policy side. And then you have the Alliance for Healthy Aging, and making sure that we have folks who, folks from people who participated in the Senior Leadership Series participating in the Alliance for Healthy Aging if they're interested in things like the workforce and zoning. And so we've had them on work groups, and we've had them on the advocacy group itself. And Jennifer, thank you. You reminded me that we actually have our first alumni on the Alliance for Healthy Aging advisory board now. So we're pretty excited about that to kind of continue to broaden, again, the non-medical voice, and have the alumni participating across so many areas. Okay. Left this slide in that, can send you the slide deck. It's just a bunch of resources, the Alliance for Healthy Aging that Jennifer talked about, Tri-State Learning Collaborative on Aging. I know that's another umbrella organization that works across Vermont, Maine, and New Hampshire. They do that membership is free for that. If you're not on there, join, as is the Alliance for Healthy Aging, getting on the listserv for both of those organizations. Trainings, opportunities, quarterly meetings. There's just, opportunities galore for you and for people within your own networks. Mentioned the Healthy Aging data reports. I did a presentation on that probably a year or two ago. They will be updated, I think, next year. I think we're already almost to the 3 years of that project. New Hampshire Care Path and Service Link. So those are just some resources that we touched on, and we're happy to answer questions for a couple. I think we got 3 minutes left, but we're happy to answer questions. And the last slide has our contact information. I'll leave that up for a second.
And I'll add real quick, I just put in the website for the Tri-State Learning Collaborative on Aging in the chat to make it easier for folks to check that out, since we didn't have time to really cover that.
And then maybe could you two also put in your emails in the chat, and then maybe if we go to unshare, if people do have questions, we can see them. So maybe if people want to raise their hands if they have questions. I can't see people though. A lot of people's faces aren't there. So I have to say that was a wonderful presentation. That was, I keep hearing so much about the center, but always trying to figure out what do you guys do and everything like that. And so that was just immensely helpful. And now we have it videotaped so we can do it. Is it possible to have the slide too shared with us too?
Yes,
that would be great too. We can always just then go back and look at it and stuff like that. Have your contact and everything you guys do. So that was wonderful, wonderful.
Yeah, I think one of the other things oh, sorry, Jennifer, go ahead.
No, I was just going to mention, excuse me, I'm losing my voice. I was just going to mention that the Center on Aging and Community Living has a listserv. And so if folks are interested in finding out more about CACL activities and events coming up, please feel free to email myself or Laura to get on that listserv. And the same goes true for the Alliance for Healthy Aging. I know several of you, if not all, are on the Alliance for Healthy Aging listserv, but there's opportunities to join that as well.
Yeah, and I've enjoyed you all joining our work group, the direct care work group recently. So that's been good, and some other work groups. I just want the other thing that kind of just a little bit more about the university context. We do work with the cooperative extension. So I know the cooperative extension has a lot of programming related to working with older people and adults with disabilities. And, so we keep in contact with them, and they're on our board. And the other thing, there's Northeast Passage, which I think Kelly had mentioned in her email to us. And that's an organization under the College for Health and Human Services that does so much great work with getting, adapting equipment and recreational opportunities for people who have differing abilities. And they're just, I can't say enough about the work that they do. And but they need a whole presentation to talk about the amazing work and opportunities that they can bring.
They are awesome. That was the best day of our years when they would come and visit us with their adaptive bikes. Oh my gosh. It was so awesome.
Yeah, good.
All right, anybody? So no other questions? I mean, again, it was such a wonderful presentation. I think you answered all of our questions and stuff like that during that. So thank you. Thank you guys so much again for coming.
Great. Thanks for having us.
Yeah, good to see you.
I'm going to sign off.
Okay.
Me too.
Thank you. Thank you.